Hello, I am Dr. Nischal, a dermatologist practicing at Nirmal Skin and Hair Clinic, Vijayanagar, Bangalore. Hair fall in PCOD is basically because of the hormones. Unless we control the PCOD problem, bringing your hair fall under control is quite difficult. Many a times, even when the PCOD comes down, still hair fall can happen because PCOD is just a tendency. So once a PCOD is always a PCOD. Many a times reducing weight, doing regular exercises do help in bringing the hair fall under control, but often you may require hormonal therapy or some specific therapies for hair growth. Usually people are put on zinc supplements, people are put on some peptides or minoxidil based solutions to reduce the hair fall. But if there is any underlying folliculitis or rash or itching in the scalp which can happen in PCOD, then we have to treat those conditions as well along with the hair fall. Hair fall in PCOD can be reversed only in the early stages when the follicle damage is not so intense. The moment the hormones shrink the follicle permanently, we cannot revive a follicle. So in those situations, whatever the hair fall happens or whatever the baldness happens may be permanent. So it is always better to get treated early. And the moment you are diagnosed with PCOD, it is always better to consult a dermatologist because it's not only a hair fall which is happening on the scalp, but there can be a lot of hair growth on the face and other body parts. Including these things, there are other skin manifestations like acne, pimples which can happen on the face, chest, back, thighs and buttocks, or it can be stretch mark, or it can be darkening of the skin which is called as acanthosis nigricans. And in this condition, the darkening is not uniform but tends to happen in the root of the neck, sides of the forehead, around the eyes, the nasolabial groove, underarms, groins, knuckles. So wherever there is a body fold, pigmentation can happen, and many a time that can be very distressing to patients. Teenagers are prone for hair fall mostly due to one, dandruff issue. Itchy scalp can give rise to a lot of trauma to the scalp skin that can affect the hair follicle, or it can be because of choosy diet habits where they are going for a lot of vitamin deficiencies or protein deficiencies, where they have very choosy about the food thing. So definitely nutrition takes a role. Then third thing is, many a times it is because of the harm or the damage caused to the hair strands as such. This is the time when people want to experiment. People experiment with a lot of shampoos, conditioners, some procedures, aesthetic procedures for the hair. It can be perming, it can be coloring, it can be streaking. All these things, if they are not done properly and if they are not taken care of properly, it can give rise to severe hair fall. In addition to this, there is a lot of stress in children or in the teenagers. See, there are a lot of exams coming up, you have a lot of friends, you have some breakups, all those things that can definitely cause hair fall. So any individual, any teenager with hair fall needs an assistant, and it's always better to discuss all your issues with dermatologists and never forget to tell them whatever you have in your mind. So you discuss out, you tell your diet plan, you tell what's happening in your life. It may be personal, but it has a lot of significance when people have to treat you, because we don't know what's happening in your mind. Body changes can be seen, but the changes which are happening in the mind can't be unless people speak out, and that can be easily taken care of.